Welcome back, welcome back, welcome back to science. All right, in 16.3, we're going to talk about the tissue fluid and lymph. We're going to talk about the natural flow of lymph and why it has a tendency to move into vessels. All right, so let's tackle it. What is lymph? Any tissue that's going to enter into a lymphatic capillary is going to be called lymph. So when it's in that lacteal, it's lymph. So what would cause something to actually go in to the capillary, lymphatic capillary? So, capillary blood pressure filters water and small molecules from the plasma. So, lymph itself is really similar to plasma in its composition, but it doesn't have the plasma proteins that plasma does. So, the other things like the amount of water or other gases or hormones, that's there. That's in the lymph as well. So, the plasma proteins, they do not go into the lymph and they remain in that capillary bed. And that's important. And it's important because of this reason. Because of osmosis, going from high water to low water, it's going to create this colloid osmotic pressure that's going to cause the reabsorption of a lot of the water that's going to be in that interstitial fluid back into the capillaries. And that's key for us not having excessive amounts of interstitial fluid that remains in this area, even maybe more than our lymphatic system could take and clean up essentially. So by keeping those proteins, it's keeping solutes. And we know that water chases solutes, and so water is going to have a tendency, a natural tendency to flow back into the capillary bed, remaining in that blood. No hydrostatic pressure has pushed it out. Now it's going to be in this capillary bed, in the capillaries, and a lot of interstitial fluid around the capillaries. And on the venule side, when it's lower pressure, roughly 16 millimeters of mercury, it's going to have a tendency to flow back into the venule side of the capillary bed. So that's going to help for the reuptake. So what the tissue fluid is going to be the blood plasma minus the plasma proteins. Those small plasma proteins, they're big and they don't escape. And that's going to create that colloid osmotic pressure, which is going to be good in helping that fluid naturally flow right there back into that. So lymph formation. Filtration from plasma normally exceeds reabsorption. As a result, you get fluid. It forms. So we know that we're filtering the plasma. Most of it is taken back, but some remains. The remaining is going to be that increased amount of fluid, as that tissue fluid is going to have its own hydrostatic pressure, which is higher than that of the capillaries. You're going to have a natural tendency of this higher pressure to enter into this capillary because this lymphatic capillary, because it is lower pressure than around it. So if you remember the hydrostatic pressure, that's arterial side of a capillary, it's going to be roughly 35 and it's going to be pushing a lot of that fluid out. We know that it's 16 downstream on the venule side of things, so a lot of it's being reabsorbed. But that area where that interstitial fluid is under a amount of pressure. The amount of pressure in that capillary, that lymphatic capillary, is less, and so it has a natural tendency to move into that capillary. This prevents the excess accumulation of this tissue fluid, which we call edema. Edema is something where you have interstitial fluid that's going to pool. Farthest away from the heart, you have the greatest amount of edema. And an example is the pitting edema. And also, you could have the way your skin responds back is another example. So, examples of edema: when a woman has her axillary lymph nodes removed during breast cancer surgery, the lymphatic drainage is obstructed from the upper limb. As a result, the person typically has edema because she doesn't have the natural uptake of that interstitial fluid. Lymph inside vessels has that low hydrostatic pressure, just like the venous blood supply at 16 millimeters of mercury. This is going to cause a natural tendency to flow into the lymphatic vessel. Now, once we're in that lymphatic vessel, we're going to have the movement of that system through three different mechanisms: the contraction of skeletal muscles, respiratory process, and smooth muscle in those larger lymphatic vessels. So, the contraction of skeletal muscle is going to squeeze, and anything that it's working along is going to be squeezed, and it's going to push the things that were in that tube as you squeeze, like toothpaste, it's going to squeeze it upward, and valves are going to keep it from backflowing. The respiratory process, as we breathe in, we're going to drop the pressure because we're expanding the amount of capacity of our lungs. As we breathe in, we've opened and decreased the pressure of our thorax. This lower pressure is going to have a natural tendency to send lymph towards our abdominal region and thorax. Once you get into those bigger lymphatic vessels, they're going to utilize their smooth muscle to have some contractility that's also going to help to move it along. Valves, as I mentioned, are going to help prevent the backflow. And if you want to know, like, when is the most active time of lymph flow, it's when you're actively doing something. So the contracting of muscles, the heavy respiration, those are big contributors to help lymph move. So the roles of lymphatic capillaries. So the absorption of dietary fats. It's very fatty. It's going to have a yellowish color to it. And a big part of that is from the dietary fats. Dietary fats means that you eat, you digest in your stomach, and you absorb into your bloodstream. You're then pumping it out. Hydrostatic pressure is pushing out the interstitial fluid, including that the dietary fat that you consumed. It's then going to take that into the lymphatic system, and it's eventually going to dump that back into your blood vessels like, no, no, no. Let's try again. And it's going to send it back to your subclavian, right or left subclavian, where it's going to be utilized and sent back through the heart. So return to a small portion filtered by blood capillaries to the bloodstream. All right, it's the collection of that excess interstitial fluid. This helps reduce edema, the delivery of excess fluid to the bloodstream, and foreign particles are going to be delivered here. Those lymph nodes are going to be these specialized locations where they're doing work. Also, lymphatic capillaries are going to have the flap-like structures, which are going to prevent the backflow. All right, let's take a look at the lymphatic vessel. Take a look at this flap-like region here and here, where they lap. Since this is a lower pressure area than the outside area where the connective tissue is, and you see the filaments that are anchored there, it's going to have a natural tendency to flow from a higher pressure to a lower pressure as it diffuses into this lacteal of this lymphatic capillary. So it's going to have a net movement into this, taking up that interstitial fluid and the dietary fats. All right, guys, this ends this little subsection, and let's get into more depth soon.